Good afternoon, everyone. I'm Dr. Akhila, consultant fertility specialist, Sudha Hospital, Banjara Hills, Hyderabad. Today, we are going to talk about how to provide care for a pregnancy that has occurred through an IVF procedure. So, let's clearly understand that the most important thing is to follow the prescription once the embryo transfer is done. To religiously follow the prescription, use all the injections and medicines, and relax and wait for the pregnancy test. The pregnancy test typically is taken after 2 weeks, about 14 to 15 days after the embryo transfer. And the pregnancy test usually is a urine pregnancy test, of course, a blood test in the form of beta HCG. So once the beta HCG is positive, we repeat the value after 48 hours. It is very important to understand why this test is repeated after 48 hours. So we are looking at doubling of this beta HCG. Now, why is doubling important? So once the beta HCG doubles, we understand that it is a good pregnancy. Probably it is an intrauterine pregnancy. So when the value doesn't double, we may have a high caution for an ectopic pregnancy or a failing pregnancy. So this doubling of beta HCG is of paramount importance. Once the doubling is achieved, we schedule a scan after about 7 to 10 days. Now, what to expect in this first scan? The first scan again is a landmark. It is a very important scan. We look for the location of the pregnancy, whether this pregnancy is intrauterine or is it somewhere else in the tubes, which may be an ectopic. So that is one very important thing to look for the localization of pregnancy. The second most important thing is to look for the yolk sac, which usually in the first scan we're able to see a yolk sac. The first scan usually is scheduled at about 5 weeks of pregnancy. So a yolk sac is seen. Now the importance of yolk sac is that it provides nutrition to the pregnancy and to the baby, and also the size of the yolk sac. When it's about probably 3 mm, we think that it's a good pregnancy. These are all some of the predictors of a good healthy pregnancy. So localization of pregnancy, we look at the yolk sac, and also of course we measure the gestational sac, that is the G sac. We look at the cervical length, and definitely we look at something called as a decidual reaction. A good decidual reaction is what we expect. Decidual reaction would mean the reaction that is there around the pregnancy, uh, which we understand based on the scan. And apart from these, we also look at the ovaries, whether there are any cysts or any other abnormalities. The adnexa is what we need to look into. If we have transferred two embryos, then we need to look for if there is any ectopic also alongside this intrauterine pregnancy. And these are some of the things that we look at in the first scan. Once the first scan is normal, we call the patient again after about 7 to 10 days to look for the heartbeat. Once the heartbeat also is established, that is when this is a clinical pregnancy, and that's when we can all consider this pregnancy to be a successful IVF procedure. And thereafter we schedule the scans. We do a serial scans every 1 or 2 weeks till about 12 weeks. Once the pregnancy crosses 12 weeks, at about 11 to 13 weeks, we do another specialized scan called as the NP scan with double marker. But after 12 weeks, this pregnancy more or less is like any other natural pregnancy. The amount of care, the injections, everything, the medicines that we give, everything changes, and it follows the path of a natural pregnancy. So it is this 12 weeks that we need to take extra care. Now, this extra care does not really mean strict bed rest. We never really advise for any strict bed rest. Routine activity can be continued, and travel, work, or intercourse, none of these have any negative impact on a positive pregnancy test. So, like I already mentioned, it is very important that we strictly follow the prescription, because in IVF pregnancies, we normally do not have something called as the corpus luteum that provides support to the pregnancy in natural pregnancies. In IVF pregnancy, since that is absent, we need hormones in the form of progesterones, injections, tablets. All these have to be taken and they have to be uh, administered daily without missing any doses. And what to expect in these 12 weeks, apart from the scans and the prescriptions that we need to follow, in the 12 weeks we may expect some spotting or mild bleeding or some cramping pain. All this could be normal. Excess of bleeding, which is probably unbearable, or profuse excess of pain, which is unbearable, or profuse bleeding. These are some of the symptoms and signs that you need to consult your physician. Otherwise, mild cramping, mild pain, spotting, minimal bleeding is something we can expect in an IVF conception. Sometimes this is also called as the implantation bleeding. So there's nothing to worry about. But yes, you definitely need to inform your clinician about this, because if you're on any blood thinners like aspirin, heparin, we need to take a call as to whether we need to stop these medicines or continue. And apart from this, the other pregnancy symptoms also can be there, which is as natural, like easy fatigability, tiredness, nausea, vomiting, increased urination. These are some of the things that are the same even in an IVF conception. And once around your 12 weeks, that's when the entire care is just as normal as any other natural pregnancy. That's when the placenta also develops, and we don't need to give extra support or extra care in the form of medicines or injections. This is all about care of an IVF pregnancy. Any questions, please? Egg quality, how to improve egg quality? So, diet is very important. Diet in the form of fruits, vegetables, nuts, seeds play a very important role, and this needs to be taken for a long duration, probably a couple of years. That's when it's called as a healthy diet. Alongside supplements, because supplements act faster. Coenzyme Q, vitamin C, vitamin E, vitamin D are something that we are looking at to improve the egg quality. Also, regular exercise and adequate sleep of about 6 to 8 hours. These are the three things that are very important to improve your egg quality and to decrease the stress. And you can do yoga or meditation and reduce the stress. So all these put together along with your supplements can improve the egg quality. Okay, so definitely IVF pregnancy is something that you need to be more careful, like I already mentioned, because there is no corpus luteum that is there to support the pregnancy, which occurs in a natural pregnancy. Therefore, taking medicines regularly without missing any doses is very important. And the complications that you can expect, which probably you may not if it's a natural pregnancy, is that mild spotting or bleeding or mild cramping pain that can be there in an IVF pregnancy. And it is sometimes called as the implantation bleeding. You don't really need to worry about this. You just need to inform your clinician, go through some tests, and follow the prescription. Thank you. Exercise recommended during the course of a pregnancy. So there is no bed rest that's actually detrimental. Routine activity is what we're looking at. Mild exercise is definitely allowed, like walking or basic yoga. Uh, no, climbing stairs is something that a lot of patients ask about. Yes, you can definitely climb stairs. That's not a contraindication. And exercise, as long as it is a routine exercise, your daily routine that you're following, that definitely we can do it in pregnancy, even if it's an IVF pregnancy, definitely. No heavy work, no difficult yoga asanas, and these are something that we're not looking at. The household work also can be done even if it's an IVF pregnancy. So the daily routine can be followed, going to work, climbing stairs, doing household work, all this can be done. So feeling tired and dizzy is it is a pregnancy symptom, but if you're not pregnant, then maybe you should look at your hemoglobin, the thyroid levels, sugar levels. These are something that you need to look into. If everything is normal, I think you can follow a good exercise, sleep routine, and good diet. I think that should take care. So IVF pregnancy is something that everybody is very anxious. People are extra cautious, but that does not mean you feel depressed or sad. The happier you are, the outcomes are better. And regular exercise, again, diet helps. Yoga and meditation can decrease your stress levels. So that is something which you can follow. And what we need to understand is an IVF pregnancy, the success is about 50 to 60% and not more than that. So that's what IVF standards are. So we need to understand that and hope for the best after a pregnancy, after an IVF transfer. Is spotting common in IVF pregnancy, or should I consult? Spotting can occur. You definitely need to consult a physician, uh, your physician. And spotting can be normal, like I already said. There could be implantation bleeding. Minimal spotting or mild bleeding can be normal. Your doctor will prescribe you certain medicines. You need to take those, and it will settle. A scan is and a pelvic examination is what they will do. You need to, of course, go and consult your doctor, or at least talk to them over the phone about what it is. Should I continue the IVF medicines or switch to medicines for a normal? It all depends on what your previous history has been. If you've had miscarriages before, then certain medicines we will continue till about 34 weeks or 36 weeks. If you've not had, then maybe we can stop some of these hormone drugs or injections. We usually stop everything at about 12 weeks. But again, depending upon what your history is, some of the drugs are continued till about 28 weeks. And it depends on whether you've had a cervical stitch or not. Routinely, cervical stitch is not recommended just because it's an IVF conception or just because it's the twins. So we only do it in indicated cases. And based on what your history is, we taper the medicines accordingly. If everything is normal, all IVF medicines can be stopped by about 12 weeks. Is there any effect if IVF is? Definitely no effect. Summer has no effect with IVF. The reason being, nowadays we have even the transport system is done so effectively that we maintain the temperatures, the thermometers. So the media, everything is under temperature control. So IVF success does not change because we are doing it in summers. The lab also is equipped with 24 hours power supply. So there is no interruption. These are some of the things that we needed to take care before we said that, IVF can be done even in summer and there's no effect. Now that we have control over these kind of things, IVF is definitely safe, and the effect, the success is as much as it is in any other season, even in summers. After IVF implantation, I'm having light pain and discomfort at regular intervals in my abdominal region. Uh, you should, of course, consult your doctor. But like I said, nothing to worry about this. Mild pain, minimal spotting or bleeding, we can expect in an IVF pregnancy. So there's nothing to worry. But yes, you definitely need to consult your physician and make sure everything is normal. Thank you so much.